Thank you very much. My name is Adrian Dix. I'm BC's Minister of Health. Beside me is Dr. Bonnie Henry, our Provincial Health Officer. We're honored to be here on the traditional territories of the Lekwungen-speaking people, the Songhees and Esquimalt First Nation, and I wanted to introduce Dr. Henry.
Thank you, and thank you very much. Much has happened in the last 24 hours, as I'm sure you're aware. I do want to start by talking about our new cases, and we have 7 new cases to report today, so our total in British Columbia as of earlier today is at 53. Most concerning for us is the fact that we do now have a second long-term care home that has an outbreak that is involved with COVID-19. This was an outbreak, as you are aware, it's the end of our influenza season, and we have been having influenza outbreaks in long-term care homes, as we expect to see during this season. And this one was thought to be an influenza outbreak as well, and it turns out that one of the residents who was tested, out of a number that was tested, a man in his 90s who's a resident of Hollyburn House in North Vancouver, tested positive for COVID-19. And in addition, it was apparent that a number of the healthcare workers at that facility were also linked to the Lynn Valley Care Center. And so we have 2 additional healthcare workers who have worked at both of those facilities who've been identified through the outbreak at Hollyburn House. And they are a man and a woman, both in their 40s, and they're both in isolation at home in the Fraser Health region. So obviously we are continuing the investigation both into the Lynn Valley Care Center and now the connections with Hollyburn House. And we talked yesterday about the fact that we do have many people who work in many different facilities, and that has been part of the investigation to track down. So these investigation and the investigation of the second outbreak, which was thought to be an influenza outbreak, converged with the understanding that this was COVID there as well. We are, of course, continuing the investigation into all of the healthcare workers, and I know there's been more testing that's happened at the Lynn Valley Care Center, and additionally there's been a number of other residents who tested negative for COVID-19 at Hollyburn House at this time. We have another 4 cases who are in the community, all of them in Vancouver Coastal Health. 3 of them are travel related. One, a male in his 40s who traveled to the UK, primarily London and Scotland. And we have a couple in their 40s, a male and a female, who are additional cases who were on a travel to on a tour and a cruise on the Nile in Egypt. So that again increases the number of people in our province who have been associated with travel to Egypt. I think, obviously we're continuing to monitor. Sorry, we have one additional male in his 50s who we have not yet determined the source of his where he picked up COVID-19. So he's another of our community cases, and he is in the Vancouver Coastal Health region and is in stable condition at home in isolation. We remain at 1 person right now who's in hospital, a woman in her 60s in Fraser Health, as we mentioned yesterday, and she is in stable condition. And on a positive note, we have 2 more of our cases who are fully recovered. So we now are up to 6 of our 53 cases who have met the criteria, both symptoms and have testing that means they're no longer infectious to others, as far as we know. So many things have changed in the last 24 hours, and I know you're aware of things that have happened globally, the issues that have happened in our neighbors to the south in particular, and it's become apparent that this is a rapidly changing situation again, and the risk for us in British Columbia, well, it hasn't changed a lot here in BC. The risk has increased all around us, I would say, and our understanding of the situation has also changed. So there are a number of things that we have been discussing today, and measures that we feel are appropriate at this time that will be taking and announcing today. In particular, we are advising British Columbians against all non-essential travel outside of Canada, and that includes the United States. I think this is really important. It is clear at this time that the evolving situation, both in the United States and globally, is a risk for all of us, and we are strongly advising people not to travel. If you do travel, anyone who chooses to travel outside of Canada will be required to stay away from work or school for 14 days on their return. We feel that this is the appropriate measure at this time, given the situation that we've been seeing, given the importation of travel-related cases and the challenges that we have in monitoring them. I will also say that we had many conversations today with my colleagues across the country, and the situation, particularly in Quebec, which has just come off their March break, where they had a lot of travel of students and others to France and other places in Europe, where, as you know, the outbreak has really exploded in many countries there. While I have full confidence that it will come under control, the situation is just too risky right now. And for people who feel that that is a risk they're willing to take, that is their decision. But we need to be able to ensure that our schools and our workplaces remain safe here in British Columbia now. The other thing that has become apparent is with the increasing transmission of COVID-19 at mass gatherings and events, and we've heard of many of them, including one's large event in Toronto where people might have been exposed. We had a person who became ill while at a large conference here in Vancouver, and that was concerning to people, even though the risk is very low. With the escalating risk of this community transmission, we have to do our best to slow this COVID-19 infections here in British Columbia and to protect people in our communities. So we are directing all event organizers in British Columbia that they will be required to cancel any gatherings larger than 250 people. And 250 people is not scientific. We talked a lot about what are we talking about. Why wouldn't we go with 1,000? And that's what's been used in some places in the U.S. and some places in Canada and other parts of the world. 250 has also been used, and it's not, again, a scientific number, but it is a number that we think has some rationale to it, in that over that large group, it's really challenging to put into place those social distancing measures that protect people and prevent transmission of respiratory infections. And those are some of the things that we talked about yesterday, being able to be at least an arm's length distance from each other, having the ability to clean your hands regularly. And so these are the things that we are now saying all of us have to take a part in. And we are looking at event organizers, whether it's community events, whether it's large events, to look at alternatives that they can use to keep that connectedness and the social cohesiveness. And that may mean, in some cases, having events where you can have a smaller number of people, reducing the number of people who come, separating them, making sure that we make allowances and allow for people who are more vulnerable to having severe infection or from dying from this to not attend events, making it easy for people to cancel out of events. And I have heard from many, many event organizers that us making this recommendation makes it much easier for them to take those measures that we need them to take to protect our health. We will be working, so what we aren't saying is that, any building that has 250 people in it should be closed. Although we are telling workplaces now to start thinking about how to increase distances within your workplace, or make sure that people can do things like working from home, if that's a possibility, or holding virtual meetings, not coming together, not traveling together. So if we're talking about a Walmart, for example, where there might be 250 people, but you're still able to take those social distancing measures. You don't have to be next to somebody. You don't have to have that close interaction. You are able to cover your cough if you cough. We'll be working with post-secondary schools, with government of BC. We'll be working with the Ministry of Education and others across across government to ensure that we can handle these measures within those settings appropriately. We also, at this time, are not taking action. We don't believe it's appropriate at the moment to close schools. They are, as I mentioned yesterday, a place where young people can be kept safe from a lot of things. They can learn about social distancing. We need to understand more about the role of young people in transmission of this disease, and we know that sometimes that the impacts of closing schools, particularly abruptly, can cause a lot of societal disruption and economic impact. So we want to be doing that in a measured way. I also want to say that these are measures for now. They're not forever. These are things that we think are incredibly important for all of us in society to think about as ways to stop this spread, to slow down. You've heard people talking about, I've talked about, flattening the curve so that we can prevent transmission to those who are most vulnerable to severe illness and death in our society. We can protect our healthcare system. We can protect our long-term care facilities from infection. We also recognize that this is our best advice today, and it has varied quite a bit from what I talked about yesterday, and that is taking into account as best we can what is going on around the world, what is going on in our own context, in our neighbors' context. And this is something that we will be reviewing daily. We'll certainly be reviewing our position on schools. We know that March break starts at the end of the day tomorrow, so we have a period of time where we can be thoughtful, we can investigate the issues around schools, we can talk with the stakeholders and make sure they know we know what is the best thing for us to do in the coming days to weeks as the situation continues to change around us. So these actions, as I said, are for now. And we will be reassessing both daily and weekly, and we'll be here to talk to you about those too. I believe these actions are necessary right now to slow down the spread of this disease and to protect the health of our communities and everybody here in British Columbia.
Thank you very much, and thank you, Dr. Henry, for all your ongoing work, and which represents the work of many, many people out in the community right now who are supporting our efforts to support people who have tested positive for COVID-19, but also the entire community as they deal with these issues. So I want to reiterate the key decisions that we've made today. First, that we're not allowing events of over 250 people, that this number was selected, not as Dr. Henry has suggested on a strictly scientific basis, but we think it's the right number and the right judgment amongst the choices we could have made to ensure that people can engage in appropriate social distancing. Secondly, we're recommending against all non-essential travel outside of Canada. That means no quarts of milk in Bellingham, no trips to Disneyland, no trips to Paris or Berlin or Boise. And anyone who chooses to travel outside of Canada, anyone who chooses must stay away from work or school for 14 days upon their return. That responsibility is what we owe to our fellow citizens. Clearly, the issues of post-secondary education and education are important. We feel it's appropriate for schools to remain open now, but we are going to use spring break. I know the Ministry of Education and others will use spring break, and the Ministry of Health and the provincial health officers to consult with stakeholders and decide the appropriate policies and procedures that should occur for students and for staff upon their return. I wanted just to note with respect to the new cases that there are 7 new cases today. That makes 53 across British Columbia. Just to put this in context, I think it shows the evolving nature of the issues, that 5 of those involve travel to China, 16 of those involve travel to Iran, although not in the last few days, 1 travel from India via Hong Kong, 1 from Washington State, now 6 from Egypt, 10 involving the broader thing around the Lynn Valley Care Center, 3 involving the Grand Princess Cruise, and others involving Germany, Italy, and one's community cases that came to us through influenza screening that we do and that are currently under investigation. That's 28 in the Vancouver Coastal Health Authority, 23 in the Fraser Health Authority, 1 in the Interior Health Authority, and 1 in the Vancouver Island Health Authority. I'd also say further that tomorrow morning at 9:30, will be posted on the BC CDC website the number of tests that have been done in British Columbia this week. That number has grown dramatically over the past week. Last week when we announced on Friday, or we showed that on Friday, it represented more than had been done in the previous 4 weeks. This week, more than had been done in the entire period from January up to last Friday. This shows significantly our ongoing efforts to contain and to slow COVID-19 in British Columbia, and reflects the commitment that was made when we started our emergency response 6 to 7 weeks ago. I wanted to comment on issues around 811. First of all, to say that the people who work at 811, the nurses and other team that works at 811 are doing an extraordinary job. I just want to put in context what they've done. Yesterday, on an average day, they receive between 1,000 and 1,100 calls in a normal course of the year. Yesterday, they received and answered 3,795 calls. And we are working hard. Obviously, there was more demand than that, but we are working hard to deal with even higher call volumes by adding resources. I know that this can be frustrating to people. We ask them to be patient, but this demonstrates the diligence and the work being done for everyone at 811, and like everyone else in the system who's working on these issues. It is, I think, a considerable achievement. We need to give them more resources, and we are. Avec les circonstances mondiales changeantes de l'épidémie de COVID-19, y compris la déclaration de pandémie de COVID-19 de l'Organisation mondiale de la santé et les risques croissants de transmission de la communauté lors des grands rassemblements publics, nous annonçons aujourd'hui que nous avons recommandé à la Fédération mondiale de curling de reporter le championnat du monde de curling féminin 2020 à Prince George. Je pense que I just wanted to note that we've also earlier today, recommended, it was Dr. Henry's recommendation, that the World Curling Championships in Prince George, the World's Women's Curling Championships, be cancelled. Nous allons aussi, nous sommes aussi en train de prendre 3 positions nouvelles pour la province, c'est-à-dire que nous allons bannir les rassemblements de plus de 250 personnes en Colombie-Britannique, que notre recommandation, c'est que personne ne voyage ailleurs qu'au Canada, et que si on voyage ailleurs, qu'il faut rester seul, s'isoler pendant 14 jours. C'est-à-dire que ce sont 3 mesures importantes pour assurer que tout le monde reste, la santé de tout le monde est protégée. And with that, we're happy to take questions.
Okay, we'll start in the room. We'll go Mike, Richard, Keith. I'll come back.
Okay. How many nurses specifically are you adding to 811, and when will they be online?
Well, I think the number of nurses, we'll get you the specific numbers. The number of nurses has already increased significantly. I think it went from 15 to 25. So we're adding nurses, but we're also adding other resources. What we're trying to do is take and divert all the non-personal health issues away. So when organizers of events, and these issues may not arise anymore, phone us through 811 to seek information about their event, about a risk assessment for event, it would be transferred to another area. There'll be a new number to deal with those issues in the coming days, and we hope that will relieve some of the burden on 811, and we're adding resources to 811. We'll get you more information.
Richard.
Dr. Henry, we've seen what you mentioned, how rare the last 24 hours have been, especially in the United States. And I think a lot of people here want to know what is the difference between what's happening in the United States and what's happening here, because you've put in some pretty significant measures just now. Is it because the situation is similar here to there? Like, how do you explain that to people about what they're watching down south and whether we're in a different and potentially better situation here?
Yeah, so I think we are in a very different situation here, and we've been watching very carefully, particularly for us here in British Columbia. We've been watching what's happening in Washington State, and we've been in contact with our colleagues in Washington State. What became apparent to me over the last 24 hours is the extent of the community spread in many, many, many different communities in the U.S. And I think it's only become apparent to our colleagues in the U.S. as well, that this is something that has gone beyond what they actually thought they were dealing with. And it is very challenging with the system they have in the U.S. for them to catch up. And we have seen many measures being implemented, including some that are very similar to what we're implementing here. I think the fundamental difference is that we have been a little bit ahead in terms of being able to understand the transmission in our community. I don't feel we have widespread community transmission like we're seeing in many places in the U.S. with a lot of undetected events. However, if we look around the world with just the dramatic increase in numbers of cases everywhere, that pressure on us is increasing and our risk is increasing. So we need, we talked last week about an all-of-government approach. We need now an all-of-society approach, because we cannot stop all of the transmissions into our province, and it's unlikely that we will catch all of them. We need to try and do our best to catch as many as we can, and we will continue to do that, and I've said that repeatedly. We will continue, no matter what phase or what part of this we're in, to follow up aggressively on every case that we know and to break those chains of transmission, because we know that's what stops the spread in our community, and it's really that's going to protect us in our communities and in our schools, and particularly in our hospitals. And we are focusing on the measures that we think are important to protect the people who in our communities who are most vulnerable to severe illness and death. And for that, we've talked yesterday about stepping up measures in long-term care, but also these social distancing measures that I'm talking about really, I hope, will signal to people that we all need to do our part to try and keep that distance between us. We know this is spread through droplets. So if we do things, all of us, on a society level, that prevents those droplets from getting to another person and prevents surfaces from making sure we're cleaning our hands, then we can slow this down and stop it and protect those people in our community that are most vulnerable. So I think we are very different in many ways. We're not at the point that they are with widespread community transmission in many communities in the U.S., not everywhere, of course, but we need to take aggressive, all of society measures now so that we don't end up there.
Yeah, and if I just I think the fundamental difference between not the state of Washington and British Columbia and the state of Washington, this effort's been led by public health officials who sometimes did not have the resources they needed to do what we did. We had done thousands of tests when they had done dozens, right? But our approach is a public health approach first, and then we're bringing in an all of society, all of government, and then all of society approach. And I think the leadership of the public health system here has made a difference. But that said, they have excellent public health systems in Italy. They have excellent public health systems in Korea. They have excellent public health systems in Japan and in France, and they're facing more serious situations than we are. So this is a world problem, and British Columbia has done, I think, an effective job to date, but that doesn't mean that the world's problems isn't here. It is here, and we have to take all of these actions, a continued aggressive approach of containment and slowing down, because that's critically important to our strategy, but also we need an all-of-society approach, and that's what we're asking everyone to be part of today.
Follow up, just a point of clarity, on the travel restrictions, what about people who are currently in the United States who are in the midst of a trip, and what restrictions will be them on timing? How do we ensure that people actually follow this 14 days of isolation? And just to Minister Dix as well, we saw these ministers in your government out today at community events. Is that going to stop? And what's going to happen with the legislature coming back?
I'll start first. Yeah, these are discussions and decisions that we've made in consultation with others, and I talked yesterday about talking to wise people, and I've done some of that over the last 24 hours. and colleagues across the country, the details we're going to work out. We will figure out how to make this work. I think it works for us that for schools, for example, which is one of the key areas where we don't want to introduce this virus, even though children seem to be relatively protected. So those are areas that we will work out over the next little while. Same with universities and post-secondary schools and colleges. But yes, we need now for industry, for workers, for people to start. We've been saying, you need to pay attention to this. We need to think about the things that we can do to reduce the impact on us and how we can best do that. And I have been receiving lots of information from people that they needed us to tell them what to do now. That my saying we'll do a risk assessment will help you make those decisions. The world has changed, and it's changed to a point where we need to say, okay, here's what we need you to do. And so that's what we're coming out with these measures today, and we'll work out the details.
And with respect to government action, I think government needs to change as well in the way it deals with people. And we had this discussion yesterday on the phone with 128 religious leaders around British Columbia. We have to, and that's what I'll be doing, which is reach out more to people, but use the internet and FaceTime and conference calls to do some of the things that we've done historically in face-to-face way, and which are important to do ordinarily in a face-to-face way when you're representing people. I think that we all have to make adjustments. Certainly, as you can expect, that I'll be briefing our caucus and we'll be discussing these issues, and we will be leading in these questions as well.
I will say, I've said it already, but I'll say it again. This is not forever. This is for now, and it may be days, weeks, likely weeks, but it may be months. And it will change, and we will be paying attention to how things are changing around the world. We want to take the best measures that have the best chance of protecting us and protecting our health with the minimum impact on society that we can. So we'll be recalibrating as often as we need to make sure that we're trying to get that right. So society can't stop. We need to keep going. We need to still communicate. We need to still have our meetings. We need to still make sure that we have those important family gatherings and things like that. But now we just need to, all of us, collectively think about how to do that in a way that minimizes any risk of transmission of infection. And if you're healthy, that's great. But we need to be really sensitive about not feeling well and staying away from others and taking all those measures that we talk about every day, cleaning our hands regularly, not touching our face, making sure we cough into our sleeve or into a tissue and dispose of it, and staying away from others when we're not feeling well.
Keith. Sorry, Keith Liaison Tom.
Still not clear what the answer was there to Richard, but if you're in the States now, does it affect you? And also, are you supposed to go into a 14-day self-isolation with no contact with anyone? And how is that enforced?
No, so it is voluntary. We will be requiring, obviously, in certain situations, like people who work for government, for people who are in schools, where we have control over that. But we're asking people to take this, and yes, people who are coming back now, we know that there's a risk out there. We know there's a risk in people who are in the U.S. right now. So we will be asking them to do that, and we have some detailed measures about what we mean by self-isolation, and it really does mean stay at home. There are things that you can do that are less risky, like being outside. So if you're concerned about things, you can have meetings outside. You can go into your backyard. It's not like you have to stay enclosed necessarily, but we don't want you to be around other people, particularly around older people, people who have underlying illnesses, people who are at risk of having more severe illness. So definitely staying away from anybody in your family who's older. There's lots of supports now that we can have, and we'll be looking to community to support people to do this, to deliver food, to deliver medications for people, and those are the things that we can start working on together.
A follow-up, you and I have talked about these testing centers that we're going to be looking through 811. What's the status of that?
We're working on those questions now. I mean, given the amount of testing, you're going to have a sense of that tomorrow. The system has actually been working very effectively. The concern is to ensure that we don't create unneeded opportunities for infection to spread in doctors' offices and others. So I think you're going to see action on that in the near future, and we'll announce it at one of our 3:30 briefings.
Maybe this weekend.
Soon.
Lisa.
Can I just ask a quick follow-up about the U.S.? So, because you mentioned the milk runs to Bellingham, so are border guards going to be stopping people coming to Canada? Like, what's going to happen at that point?
No.
And for Americans as well, who might not be privy to our news.
And Dr. Henry will speak to this as well. But what we're saying to people is don't go. And certainly that there is, this is a part of our obligation to one another, not to do that sort of thing. Buy a liter of milk in White Rock and not buy a quart of milk in Bellingham is one of the sacrifices that we're going to have to make in this time. And so, no. That's not our jurisdiction to be at the border and stop people from going. But it's our expectation that should people go to the United States for something so important, for example, that they feel they need to go, that it would be important enough that they would choose to self-isolate for 14 days when they come back.
Americans who are coming up here who might not be privy to our restrictions.
Yeah, so there's very similar restrictions, as you probably understand, in most states right now. So yes, this is voluntary. We can't police everybody, and know that at the borders the government of Canada will be putting similar recommendations on their travel advice. So that has some weight to it. But no, we're not closing the borders. People still, some people live on other sides of the borders. There may be reasons why people do travel. But, and why people need to travel internationally. We're strongly advising people that we recommend against all the non-essential travel, and we will be asking people to self-isolate and make them aware of that here in BC.
And for the homeless population that we have here, what more is being done for them?
Yeah, so as I mentioned yesterday, there's a coming together of the groups that provide services to the homeless, and we talked about our deputy ministers committee and other fora now that are able to share that information and communicate with stakeholders about the issues that need to be addressed, and that work is ongoing. I don't have any additional details today.
Tom?
Minister, can you say at least roughly where the testing centers are and how they will take referrals and appointments?
We'll be speaking to that in detail when we're ready to announce them. But what I can tell you is that we've done, and you'll find this out, an extraordinary amount of testing in the last week in British Columbia, and that number of tests relative to the number of positive tests is one of the positive signs, because of course that testing is of a group of people that where the possibility of COVID-19 is being tested. So that process is going well. It's been going on from the beginning, but we're looking at other ways through health authorities to give people other opportunities to get tested in a safe way. But our advice always is to call first, and that will be the case after the fact. So this isn't a place where everyone comes and says, I want to get tested and get tested. This is based on referral from a healthcare provider, based on referral after an 811 call.
Shannon and Mon, then we're going to go to the phone lines.
So people are being asked to self-isolate for 14 days. The federal government is working on changes to employment insurance, etc. BC doesn't have a paid sick leave requirement at this point in time, and so a lot of people are having to make a very tough decision if they have no pay coming from their employers potentially for 2 weeks. Is this something the province would be looking to address in future?
This is something the Premier is looking to address tomorrow, and he'll be speaking of tomorrow, I believe, when First Ministers come together. It's something that I know he feels very strongly about, and it's an issue that's not just about provincial government, but as we've seen with the federal government, and we're going to be working with the federal government, obviously, to assist people in this period.
And I will say as well that that's part of the decision making that people have to have now. About whether your travel is essential. And this is for the protection of your personal health, but also for the protection of the health of our community right now.
And just Alberta's courts had an update as to how they're handling things out there. They aren't canceling things so far, but sort of proceeding with a don't come in if you're sick. Does BC are there any developments on that side in BC?
Well, first of all, the one thing I would say is that we've been dealing with issues, for example, around self-isolation for a number of weeks now. And I would say, and I think all the evidence, and Dr. Henry can speak to this in the detailed cases, we've received nothing but cooperation from people. So obviously, if you look at the Public Health Act, there are significant powers in that act to constrain people should that be required. And the reason it hasn't been used is it hasn't been required because people have been very cooperative, and we hope they continue to be that way. I mean, if you look at the development of cases, for example, you'll note that the last case from China was, I believe, on February 14th. The last case, there was a case via Hong Kong subsequent to that, but the last case from China was February 14th, which shows that some significant change in where this challenge came to British Columbia for. There were significant cases from Iran, and we haven't had one in the last couple of days, although there's no guarantees in either case. But what it tells us is that people are responding very well to what we're asking them to do. And so, well, we do have significant powers, as you've seen, both, and you've seen it in our plan to address pandemics. We do have significant powers. People have been very cooperative, and I think the community has been extraordinarily supportive. And as Dr. Henry has suggested, for example, when we saw this early on, when there was a number of cases of self-isolation, particularly in the Chinese-Canadian community, people mobilizing around them to provide supports. And so this is the community doing this. This is a community response, and we need the community to respond, and they are.
I just say, you know, that's one of the factors that has gone into some of the decision-making today. You know, when it was China, we could focus on that. We could support the community. We could support people who are coming back. When people know the risk and they know what you want them to do, the vast majority of people, if you give them the means, will do it. And what we're finding now, I mean, just in the last week, we've had people from Italy, we've had people from Scotland, from Germany, from France, and it's from Egypt. It's changing so rapidly, and many of those countries, we had imported cases or exported cases before they recognized that they had an ongoing challenge in that country. So it's becoming such we can't tell certain groups of people anymore to do something. Okay, it's all, if we could say only those people who are coming from Italy are at risk, but we can't say that anymore, and that's one of the reasons why you know, I believe that travel outside of Canada is very risky right now, and it's risky that you're going to come back and bring it into our community. Not intentionally, nobody wants to bring this into our communities, but unknowingly. And that's going to put people at risk here. And the only way that we can try and slow that down and slow down the progression of this is to try and warn everybody who's coming in from areas that are at risk, and then deal as much as we can with the disease that we have here in British Columbia already.
Question for the Minister. Don Davies, federal MP, has expressed concern about his enormous difficulties getting specific estimates from the federal government about the potential spread of the infection rate, how many cases would be in the range, and also, very difficult, finding out the state of preparedness in the system. How many respirators are there? What kind of supplies do we have? At what point does the system get overwhelmed? Is that a valid concern, and can we get some of those numbers here in British Columbia?
Well, in detail, we laid out what our pandemic plan is. Certainly, we respond to detailed requests for information. We're briefing here every single day. Last week, every single day for more than an hour. So in British Columbia, all those questions are being answered. I think with respect to the federal government, I think all the questions we get asked and answered, I would say. I don't know, and you've asked a question now, and we're coming back, and we'll try and get you an answer. We were asked about 811 calls, and we've done those questions. So we're here every day to answer the questions you have, and so, you know, that's what we're trying to do. So if it just finished, and then I'm happy to.
One federal health minister said yesterday the range of infection in the country could be 30 to 70% based on her model. I've been told you're doing modeling here. Does that number agree, 30 to 70%, with BC's model?
So I'm going to have Dr. Henry respond to that in a second, and then we'll take it from there. But I think that with respect to the federal government, I would say that they're doing a very good job. They're certainly keeping us informed. We had a health ministers conference call today. They're working with us with respect to getting more access to supplies, which is very important work that we're doing together. They've said that the $1 billion they've put on the table is a down payment, and that they would be fully willing to participate more fully, and I think that's a positive thing. And I think the relationship is good. I'm not judging the political debate in Ottawa that's taking place, but I can tell you that when we ask for things or answers from the federal government, we're getting them.
And I actually don't think the modeling is a political question. It is something that we are working very closely with. We have modelers at the British Columbia, the BC Centre for Disease Control, that are working with the federal modelers. What Minister Hadju spoke about was estimates that were based on one type of model. There are many different models that we're using, and one of the ones that we are using in British Columbia, so models can be used for many different things. They're not predictive, but they do give you a sense of what could happen. So the model that she was talking about was based on early evidence from early numbers from China that did not take into account some of the public health measures that were applied there. So things like restriction of movements and quarantines and contact tracing and all of those things. So it is a basic model that's based on numbers that were early on in the outbreak. So it is one of the estimates that we are using. It may or may not be useful, and I think I said this the other day, you know, all models are wrong, some of them are useful. And it is about what assumptions you put into your model. So that model is based on certain assumptions. We are also using, to help us plan, we're using some of the empiric data, not just from China and from places outside of Wuhan, but also looking obviously at the early numbers in Wuhan, but also from Italy, from understanding what's happening in Lombardy in particular, in northern Italy, and looking at places like Korea and Singapore, where they have done measures, and we can estimate on a day-to-day and translate that to our population in British Columbia, which is a little over, just under 5 million. So yes, we are doing that in details, and it tells us how many people per day would we expect, given what we know about how many people get really sick and need hospitalization and need ventilatory care, how long people are on a ventilator for, how long they tend to stay in hospital for, all of those modeling pieces that help us say, okay, well, what do we need to do to predict, to protect our hospitals, and then how do we need to decant? We talked about decanting the other day, move people out of the hospital, what sort of beds, how many ventilators do we have? We know that. We know where the ventilators are, what type of ventilators there are, because some of them can be run by need a very specific respiratory technician to do, and others, people like the post-anesthetic recovery nurses or some of the highly trained nurses can use different ventilators. So we are trying to get a better understanding in detail of who in our province is able to do that. And not only that, we are looking at who retired recently that could be doing that. Both nurses, physicians, respiratory therapists, perfusionists. I mean, it's a complicated thing to manage somebody on a ventilator in the ICU and or to use what we call ECMO, extracorporeal membrane oxygenation, which helps oxygenate the blood when people's lungs aren't working. So those are all part of our scenario planning that we've been doing. We have a group of medical experts that are weighing in on that, and we have the modelers and the public health experts who are looking at, okay, so what interventions can we do to try and slow that, as we call flattening the curve and stretching it out, and, so that we don't have a major surge. And that's, you know, that is what we saw in northern Italy, that there was a lot of people very quickly who overwhelmed part of their system there. I will say I'm heartened to hear that a group of trained clinicians from China and are going to Italy, I understand. That was announced yesterday with ventilators and expertise to help them there, which I think is a great thing at this point. But we are doing everything we can so that we're not in that situation, and that's the focus of what we're doing. But we are using modeling.
And should you wish more information on details, so we're happy to provide it. And in the case of equipment, we're also actively out there looking to purchase more equipment should it be required.
Okay, we're going to go to the phone.
Yesterday, swabs and personal protective equipment, the two things you mentioned yesterday, the province is trying to buy. The question I had was, isn't everybody in the world trying to buy those? And are there really enough supplies out there for every healthcare system in the world that needs them?
Well, first of all, we have a pandemic supply in British Columbia. And in addition, because there's uncertainty here in terms of the length and duration and so on of what we're dealing with here with COVID-19, we're obviously out to look to get to more. And really, should we not require them, that wouldn't be a lost venture. So we're out working with the federal government and on our own to get the appropriate equipment we need to prepare for the months to follow.
Okay, going to the phone, we have Penny Ducklos from CTV. Go ahead.
Oh, hi there. I have spoken with doctors who tell me they are turning away suspected COVID-19 patients because they don't have enough masks and other personal protective equipment. And I spoke also with people who are on hold with 811 for hours and never got through. So I'm just wondering, is the medical system already at a tipping point?
Yeah, it's not at a tipping point. The challenges that we have in the community have been there all along, and they wax and wane. And we do know that the 811 has been a challenge, as we've talked about. And we're working very closely with community physicians about addressing some of those needs and looking at how they, as communities and practice communities, can more effectively organize. So part of it is health authorities working with them around assessment centers, but how to organize in their practice to make sure that people can be tested safely. I think the bottom line is, if you have symptoms, the first line that you need to do is to self-isolate. If you need medical care, that is where the health system is there for you. If you're at that point where you have shortness of breath or you have challenges with with this disease, we're talking about shortness of breath or difficulty breathing, then by all means go into the emergency department, call ahead. If you are in distress, call 911. Let them know that you have a respiratory illness so you can be cared for safely. But some of the glitches that we're seeing in our community are more for people who have milder illness, who have concerns about this. And the bottom line is they need to stay at home until we can make a way for them to be assessed safely.
Graham Wood, Glacier Media.
Hello? Hi, Bongi?
We're listening.
Hello?
We're listening.
I'm just trying to ask, can Bongi elaborate on the school situation? Why exactly are kids safer in school?
Yeah, so we've been working with the school districts around the province for several weeks since this all started about things that they can do in schools to reduce the risk of transmission of infection. And ideally, these are the things we would be doing all the time, particularly during respiratory season, but we've heightened that. So it's things like opportunities during the day for kids to wash their hands. So they now, do it in the morning when they come in, before they go out for recess, before they eat lunch, having an understanding of the respiratory transmission, opportunities to talk to children, especially young children, about their anxieties about this, and many of them have that. There's enhanced cleaning in the school, so cleaning the high-touch areas more frequently, things like that. And, if this becomes, we know that many families rely on the schools for a variety of different things, not just for education for their children. And it's a place of growth and learning, social learning. It is in some cases a place where people have access to food for low-income families. And it can be a real challenge if children are off for extended periods of time. And it differentially affects children who are not doing well in school. And we know that if they're off for a long time, many of them will never catch up. And that is a period that affects the rest of their life. We also know that single-parent families are more adversely affected should schools close. So, I believe if there is risks in schools, then absolutely we will close them. But otherwise, we need to look at how do we make schools a safe place to allow children to be in a situation where they continue to learn, where they can be protected. And there are things that have been used in other parts of the world during H1N1, for example, things like alternating classes, reducing the number of kids that are in the school at the same time. So these are all things that obviously the school districts will be thinking about, and we'll be working with them over the coming days and weeks.
Paisley Woodward from CBC.
Those details were. Yeah, Adrian, you talked about the equipment. Can you commit to getting us information about the number of respirators in each hospital, or at least in each health authority, for tomorrow?
Well, we can get you we'll get you information about equipment and beds, absolutely.
Okay. Andrea Wu, Globe and Mail.
It's hard to find that out. We keep getting routed around. The other question is for Dr. Henry. What do you think of those drive-through testing centers they have going in the States?
Yeah, I know they've done them in Korea in particular. I think that's an option, absolutely, and we've done similar sorts of things when we've needed to test a group of people who were close contacts, for example, and we've had them go to hospital emergency department parking lots and stay in their car, and the nurse goes out and takes the swab. So that is a model that I know the health authorities are looking at. I don't think we're at that point where we need that right now in our community, and we need to understand a little bit more, and there's models that will work in different places, and I know some communities are looking at a similar kind of model for sure.
Okay, Leanne Young, CBC.
Oh, hi, this is actually Andrea Wu from the Globe and Mail. I have questions about two things. The first one is how were the COVID-19 cases first detected at Hollyburn House, and do we know how the virus was introduced to the facility? And the second is why advise against all out-of-country travel and require this 14-day period of self-isolation and not against travel within Canada? I ask that because we know that there are states and certain countries that have fewer cases than we have here.
Yes, very good questions. Maybe I'll answer the second one first. I think it's more that we have a good sense of what's happening in Canada, and as you say, there are countries that have fewer cases than we do, but we have no control over what's happening in those countries. And even though some of those countries are reporting low numbers of cases, take Egypt for example, it's becoming clear that there's enough circulation there that they've exported a number of cases to us. So it's more having detailed understanding of what is going on in Canada and not having that degree of understanding of risk around the country and around the world, and knowing that it changes rapidly. In terms of Hollyburn House, as I mentioned, it's still our influenza season, and we are seeing influenza outbreaks, so we do have a protocol for ILI outbreaks or respiratory outbreaks in long-term care homes, and this home was identified as having a couple of residents with respiratory illness a few days ago, and so it was put on outbreak protocol, and swabs were taken to test for influenza and other respiratory viruses. And of the number of swabs taken, one of them, a man in his 90s, tested positive for COVID-19.
Okay, we're going back to Leanne Young.
Hi, so Dr. Henry, as you say, a lot has happened in the last 24 hours, and I know you guys took the time yesterday to address religious leaders. And yesterday you weren't saying there would be cancellations with any religious gatherings, just encouraging social distance. But today, with this new rule about 250 people at events, does that now include, for example, churches who often hold gatherings with more than 1,000 people every weekend? And some of the faith leaders I've spoken to say that they are looking for that direction from you.
Yes, and it does include religious gatherings. As I mentioned yesterday, I do feel that looking at what has happened in other countries, that religious gatherings are a place where we have seen transmission of illness. And as we have more cases in our province, it becomes riskier. So we are asking religious leaders of all faiths to look at ways they can reduce the number of people that meet in public together or within a building together, have social distancing for those people, and look at alternate ways of supporting people to partake in those really important rituals that happen around our religious services in a way that's safe for them. And I've received some emails since yesterday from some of the innovative ways people are looking at this, and really particularly people who giving them permission not to have to come to or not to come to a particular building to practice their faith. And I think that faith is more than showing up. It's showing up perhaps spiritually and mentally as well as physically, and supporting people to be able to do that in a communal way without actually physically being together. And I think there's lots of great ways that people can do that, and I know that our faith communities are looking at that.
Okay, no more questions on the phone. Coming back to the room for those I missed, Cindy and Dirk.
I wanted to follow on Vaughn's question, if I may. When you talked about you have some different modeling or various different modeling that you're using. So if that one modeling said 30 to 70% of people could become sick, is there another approximate number that you could offer up under a different kind of modeling?
No, so models give you different things. So those are all a part of what you could look at. So yeah, so it could be 30, it could be less, it could be more. I think 30 to 70 is what everybody's kind of stuck with at the moment, given what happened in China. But as what we'd really like to have is a serology test, something that tells us how many people in that community actually were infected. And that would give us a better sense of what the attack rate was. So the attack rate is, how many people in a community are actually going to be infected with this. And then of the people who are infected, how many of them actually show symptoms and get sick enough to need medical care? And then how many people who are sick and need medical care need hospital care? And what proportion need ICU care? And it's varied. It's varied. We have some data. The most data comes from China, and it shows that, as we said, for most people, this is a mild to sometimes really yucky thing, but we'll do fine at home for the vast majority, so 82%. And that's probably, an underestimate given that we don't know how many people were actually infected. But 82% of the 72,000 in China who were detected with this had mild disease. But if we look at a population level, even 4 million people here in British Columbia, 15% of people that need some sort of medical care, and somewhere around 3 to 5% who might need hospital care, ICU care. That's an awful lot of people if we have an attack rate of 70%. So we need to find a balance in there, and in terms of planning, if we look at translating that to the Lower Mainland, other communities around BC, and then we look at, well, what's our capacity and how can we support depending on where it happens in our community over time. So it's not also, everybody gets sick all at once. It's some people get sick and it goes over a period of weeks, and what we want to do is make sure that we can stretch it out as long as possible.
Follow-up, just to ask if, based on your projections, is there a country now that's a bigger threat for transmissions, and is that the United States? And secondly, if you're advising people, if they believe through travel or symptoms that they have COVID-19, to seek out advice through 811, is there a point at which you just ask otherwise healthy people to just stay home and isolate, or do you build assessment centers?
Yeah, so the answer is yes to all of those. Yeah, so it's around the world right now. We know that the number of people traveling back and forth across the borders with the United States is immense. Thousands and thousands of people cross the border every day. And so that is a risk for us. People go to a whole bunch of things in the U.S. Many of those are now being canceled. You know, we know that a lot of conventions and events and things have been canceled on both sides of the border now. So that will drop down and the risk will decrease. But right now, one of our biggest risks is the United States, not because it's out of control there, but because we have so many people going back and forth. So even if a small proportion are exposed, then they can bring it home, and that can be a challenge for us. In terms of, yes, at some point, if we have a lot of community transmission, we will be telling young, healthy people who aren't getting very sick, stay home, self-isolate, and here's how to take care of yourself. We have guidance about taking care of ourselves and taking care of family members who aren't that sick, and here's when you need to contact people to go to a hospital. We're not at that point yet, and we're still at the point where we very much want to find everybody that we can to make sure that we can find any contacts they had. We can try and make sure that they're isolated before they have the opportunity to pass it on to somebody else. And we will continue to do that, but that is one of the measures that we will take if we need to, if we get to that point where there's a lot of people that have very mild illness that don't need medical attention.
Dirk.
Dr. Henry, I was also focusing in on the 30 to 70% number. What if, or does the modeling at all consider if everyone in British Columbia does wash hands a lot, social distancing, stay home if sick, and you flatten down the curve, do you have a model on how much we could reduce that number?
Yeah, we could probably reduce that number to a place where we can handle it in our system, and that's the goal. That is absolutely the goal. It's challenging to know how much each intervention has an effect, because all of the studies that have been done have been retrospective, looking at a bunch of things that have been done. So if we look at SARS, for example, after SARS, they looked at, okay, all of the things that were done in the community, did that help decrease transmission? We do have some really good evidence, obviously, from China now that the WHO came out with when we looked at the epidemic curve, and it actually fell really rapidly. And what it showed was everything that they put in place probably saved hundreds of thousands of people from being infected and thousands of people from getting sick and dying. So that tells us that that suite of interventions had a really important impact. So our balance is, putting in interventions that that people are able to do, that we can sustain as a society for as long as we need to sustain, and balance that with the best protection that we can get. So we do feed these things into the model. It's not exact, and we talk about the models are built on assumptions, and these assumptions all have degrees of gray to them. So. And modelers spend lots of time arguing about, well, you assumed this and it should have been that, so that's why you get 30 to 70. There's no one number. It's a spectrum, and so we try and play with that spectrum and see, well, if this happens, what happens with that? But the importance, in my mind as well, of building these models now, and some of it is to help us prepare and think about, okay, what do we need to do and how do we need to take action, but it's also to track what we're doing and say, okay, if we're here and our model we were working on thought we should be here, what do we need to do to try and address that right away, so we can see if what we're doing is having an effect or not, if we need to take more stringent measures, or if they seem to be tracking along where we're hoping they're going to be. So modeling is something that helps us in decision making and on an ongoing basis. And I'm probably rambling on a little bit about it, but it is something that it doesn't tell us what decision to make, but it helps us look at what are the possibilities that could happen with each decision.
Right.
Kirk. Oh, sorry, Minister.
Okay.
You okay? Kirk.
Kirk from CTV. Minister, we know you're working on the 811 system at this point. What do you tell the people who have all the symptoms, are phoning in, trying to get information, and they can't get through? What are their options?
Well, what I can say is that yesterday we dealt with more people in 811 than has ever been dealt with before. It was a dramatic record, and that people are working hard on 811, and that people need to be patient, and that's what we're doing. We essentially did more than three times yesterday what we would normally do in a day, and that reflects the hard work of nurses and other people working at 811 and we're going to continue to add resources, but we're going to continue to respond. I mean, I think that I find and I think that the work being done in the community is extraordinary, and so what we need, and this is important, that if you're sick, to continue to self-isolate, to stay at home, and we'll keep trying 811 or your primary care provider, and then make arrangements before you would go in, should it be required for you to be tested. And so I think we're continuing to move on that. The fact that we've been able to do so many people in a day, these record numbers, is a reflection of added resources and the extraordinary work of the staff there. And so I'm very respectful of that work, and we're going to keep trying to do better.
Okay, one more from Mike and Richard, and then I'm going back to the phones.
In terms of the COVID-19 hotline, how soon are patients or doctors getting results, and if there are delays, what's happening there?
Yeah, so there's a challenge always when we have a lot of testing being done. So the results depend on which lab it goes to. But once it's in the lab turnaround time is within 24 hours still. But that can mean it can be sometimes 3 or 4 days before the sample gets in the queue, gets tested, and gets back to the patient or to the doctor.
Are there issues around casinos where people are touching chips and moving money around, and also issues around sports? And people are looking for guidance on youth sports clubs and whether they should be attending their soccer games or hockey games.
So, casinos, I think all environments need to look at enhanced cleaning. And once again, the virus is on surfaces for a period of time, but it doesn't get into your body by being on money or being on your hands. It gets into your body when you inoculate yourself through your eyes, not even if you eat it, because we know that your stomach acid kills a lot of things, but it's getting into your eyes and your mucous membrane. So cleaning your hands is really important, and cleaning within those environments is really important. The same goes for gyms, and making sure that you have personal distance, that you don't go if you're not feeling well, and that there's enhanced cleaning measures in those places. And I know the gym that I go to is pretty good about that. The other thing about this is, events that are outdoors are much less risky, and events that are in larger arenas and things. So this virus does not transmit well outdoors, as most don't, most infections. So outdoor things are less risky, but you don't want to be sharing water bottles with your team, clearly. We want to make sure that there's hygiene measures that are taken in the locker rooms and things like that as well.
Okay, that's it. Thank you.
Okay, thank you.